Hi friends, importance of conducting an eye exam for children. How often should we conduct an eye exam? These are the questions I'm going to be answering today. So, eye screening is different from eye complete comprehensive examination. And the US study shows that children should be given a complete eye exam every 2 years. Every 2 years, at least a complete eye exam. And eye screening should be done every year in all schools or in all children who are going to schools. The reason is because there are very high chances now children are getting glasses. 1 in 5 children have got refractive error, so they need glass prescription. So what if they don't get glasses made who have refractive error? They can get headache, their ability to perform in class goes down, and for no reason the child is penalized by the teacher and the parent. The child also doesn't know how to tell that he has an eye problem because he is not aware. So what are the symptoms of a child having eye problem? Him rubbing his eyes is one. Second, squinting, squeezing his eyes to see the blackboard or the TV. Going close to the TV and watching at home. Sitting very close and writing. If he is very closely writing down, and when you make him sit down again, he goes back, or he writes. A lot of mistakes are there when he is copying from the blackboard. So the teacher and the parents, especially the mother, should be very much aware of how to catch the children's eye problem very, very early. So how early can we detect a child's problem? Even before the age of 6 months, we should check the child's eye for any white reflex. If there is anything white in the center of the eye, it should be checked. After 6 months, 1 year of age, when the child is able to watch the TV, if he is going close by, please get them at the earliest. Even some pediatricians might not be aware. They say that we can take the child even at a later date. If there is squinting, as early as possible, the child should be screened. School-going children should be screened every year. And eye complete examination. What does complete examination mean? Complete examination means checking the power of the eye. It's called visual acuity. We check with the Salem chart and to ask the child to read letters or numbers. And there are even for children who don't know how to read numbers or letters, there are also symbols or pictures by which they can just tell a cake, a horse, or a pen. Those kind of things also they'd be able to say. There are, based on the ages, we have charts for them. And apart from the visual acuity, there is also a cover uncover test to see for any minor phoria and tropia. Minor squint can't be made out. The only way to make out is through a cover test, cover uncover test. So that should be done. And then to check for major squinting, any ocular movements, movement disorders, stereopsis, three-dimensional image, whether both the eyes are working in synchrony. That to test, a stereopsis test need to be done. Color vision test needs to be done. And comprehensive fundus examination to check for the retina, how the retina is functioning. So any allergies or infections in the eye, dry eye, all these are some of the things which need to be checked for a child. So just by giving a vision testing doesn't mean the test is over. So this is called a comprehensive exam, and in certain countries it is mandatory that every year that the vision certificate needs to be bought by the parent. So this is still not completely implemented in India. CBSE schools have got it. I wish and hope the state board and the matriculation schools, all the other schools also follow the same, so that the child's vision and the child's future is kept intact. Dr. Sashi, thank you.